There we go. Happy Friday, week 8. We're in the home stretch here. If everybody could turn their cameras on, that'd be fantastic. April, I can't, your camera's on, but I can't see you. There you are.
I'm getting some stuff together over here. That's why.
Sure.
For my kids.
Yep, no worries. How's everybody doing? I know things are getting busy for you guys. Your group projects were fantastic. You did a really nice job on them. We're not going to have, I've already had 2 PN sections this week. We're not going to have time to do our presentations this week. We're going to be doing them next week. Because I want to do, we have to cover 2 weeks of content, and I want to, we're going to be doing quiz 5 today. Okay, we'll do that after we finish the content, and then we'll go through the quiz. Okay, so let's see, study guide. I'm working on it. I've been trying to work on it for the last 3 or 4 days. There aren't enough hours in the day right now for me. So I'm hoping to get this study guide out to you guys tonight, or at the latest tomorrow morning. I'm almost done with it. So I'm working on it. So you'll have it for next week's reviews. Okay, so next week are reviews for exam 3. They're on Monday, Wednesday, and Friday. There's a chance I might need to change my Friday one to either a day earlier or over the weekend. I'm traveling Sunday with my grandson. We're going to Chicago. He has to have some, he's having a hemispherectomy. So yeah, anybody know what a hemispherectomy is?
No, it's removal of something. I said, I know the acne part, I know that's removal, but I don't.
Yeah, he had a perinatal stroke when he was born 10 months ago.
Oh,
Yeah. So anyway, he's having a hemispherectomy to try and get these seizures stopped. So I'm going to be traveling to Chicago with the kids to have this done. So his surgery is next Thursday. So I'm not sure if I'm going to be available next Friday. So there's a possibility that I might be sending you guys to Dr. Kershaw's class next Friday, but I'm just not sure yet. She teaches at the same time. It would just be a different Zoom. So I'm not sure of that yet. And if I do need to make some changes, then I'll have to change the review session from Friday to either Thursday, or maybe I'll wait and do it over the weekend to give you guys opportunity to attend one over the weekend. So more info to come on that. Okay. So next week's review week, we got a busy next couple of weeks. Next week's week 9. And so your HESI prep assignment is due. Hopefully everybody's been working on that. I've already had lots of students turn it in already. So feel free to turn it in if it's done. And then week 10, you have your exam. And then during week 10, we'll do some HESI reviews. Okay, we'll do some HESI, probably 3 HESI reviews. And then week 11, you're right into HESI. So you got busy weeks coming up. Don't forget about your vulnerable populations assignment. That's due in week 10. Hopefully you're already working on that. I've had several students turn that in also. So if you're one of the ones that turned it in, great job getting things done early. So it's getting busy. Getting busy. So today we're going to cover week 7, last week because you're having an exam, week 7 and 8 content. I'm going to use the notes that I send. We're going to review those. Make sure you review your readings. Many of the readings for week 7 and 8 are not full. I think there's only like 2 full chapters in your fundamentals book. Otherwise it's different pages, a select amount of pages out of certain books and certain chapters. So make sure you don't read the whole chapter. You know, all those chronic complex diseases in week 8, You're just assigned a handful of pages in each chapter to read about each one of them. So do not read those whole chapters from start to finish. Okay. Just the information that was assigned to you. What else? There's something else I was going to mention. Does anybody have any questions? So your study guide will cover weeks 7 and 8 today, and then next week, week 9, and then we'll be done. Next week, we'll be done with content. Okay. And thanks to everybody who filled out their midterm evaluations. I appreciate it. Okay. Any questions going forward? The announcement I send out this weekend is going to be more of a roadmap. And it's going to combine all the rest of the week. So it'll be weeks 9, 10, and 11. Okay, so try and help you keep organized. All right, so let's get going. Does anybody have any questions before we start? Anybody, you guys reviewed chapter 7, chapter 8, information, readings, you know what topics we're going to be covering?
Absolutely.
Okay, I'm going to share my screen. I'm echoing with somebody. Who am I echoing with? So I can hear myself talking back.
You need to put your.
Is that better? Okay, let me share my screen and we're going to jump to our week 7, pardon me, week 7 notes. Okay, can everybody see my screen? Okay, let's talk about disasters, bioterrorism attacks and disasters. Let's just think about disasters for a minute. We know that disasters are either man-made or natural. What are some examples of natural disasters? Hurricanes?
Like flooding.
Flooding, tornado.
Earthquakes.
Somebody's echoing when they come off mute. I don't know who that is. What's some examples of man-made disasters?
Explosions.
Pardon me?
Explosion, will that be considered a man-made disaster?
Yeah, explosions, warfare, water supply contamination, fires, right? Please understand the difference. There's 2 types of disasters, and please be able to identify what is a natural and a man-made. Okay. I'd also like for you to review in the, let's see, it would be chapter 44 in your med-surg book. I'd like for you to review the Healthy People 2030 objectives for disease mitigation during a disaster. Okay, there's 4 phases of a disaster. There is prevention, pardon me, prevention, preparedness, response, and recovery. We as nurses in the community can play a role in all those. We're expected to be able to jump in and participate in any one of those phases. So some of the Healthy 2030 objectives for disease mitigation, those are focused on preparing, alerting, and caring for people within a population. Okay, whether it's before, during, or after a disaster. Okay, so their main focus is messaging, communication, making sure people are aware of what's going on. And I know we've come long, long way in the last several years as far as communities, whether they have phone calls or alarms or sirens. Okay. We need to help prepare our community for home safety during the event of a disaster. And one main thing we focus on in this chapter is how do we prepare families with regards to a kit, putting together a disaster kit. Okay, and so the 4 things that we want to prepare families with as we're doing our teaching for disasters and how they adequately get ready is to stock food for 3 days. There's 4 things: stock food for 3 days, review your kit every 6 months, make sure all your family members know where the kit is, make sure everybody knows how to turn off utilities if they need to. Why do we check our kit every 6 months? Why do we check our kit every 6 months?
You said, what do we check in our kit that every 6 months?
Uh-huh.
That nothing is expired?
Exactly. So we don't check our kit every 3 months. We check our kit every 6 months. Okay. But those are the 4 key teaching strategies that we in the preparation phase is putting together this disaster kit with those 4 things in mind. Has anybody ever participated in a mass casualty exercise? And what is it? Does anybody participate in evacuation drills or fire drills where they work, or your kids in school?
Yes.
Why do we do that?
Just in case of a event happens, like a casualty event or a hazardous event, like a tornado or fire, so you know what to do before it happens.
Okay. Yep. And one of the main purposes of the mass casualty exercise is we evaluate the response. Right? What is the response time? What is the command center? How does that look like? How quickly did it get set up? Did they know what to do? Did they know what to delegate to who? Right? When was emergency services contacted? How well did they respond? Because we know that early response system can decrease the casualties. Right? So mass casualty exercises are a big part of disaster preparedness. So we know that during a disaster, FEMA is going to respond. What's FEMA? FEMA is our federal emergency system. They're the federal agency that's going to respond to all disasters. When we hear about disasters or see about disasters on the news, we always hear about FEMA responding. Federal Emergency Management. Okay, they're kind of the overall, they're the big agency that then starts to delegate out other agencies in providing help and support. One of the agencies I'd like for you to know about is called the National Response Framework, the NRF. This is an agency that FEMA will deploy to communities, and they provide specific needs to communities. Okay, they provide 5 specific needs to any community, and they're listed in your notes: transportation, temporary housing, medical resources, search and rescue, and firefighting. So they're different from FEMA. They come in and provide specific resources. FEMA is organizing the whole disaster command center. Okay, so please know what the national framework is. That's what I'd like for you to know about disasters. Let's talk about infectious diseases. We talked early on about the epidemiological triangle. The epidemiological triangle is made up of an agent, a host, and the environment. Does anybody know can anybody define what any of those 3 are?
The host isn't that who carries it? Like how it is getting spread now?
Right. The agent, go ahead. No, go ahead.
I'm about to say, and the agent is like if you, like like TB, like how it gets spread, like in the air, it might be a host, and then how you pick it up and the people that are walking around with it are the agents.
Yep. So the agent is the actual bacteria, the virus, the chemical, COVID, flu. So you have to have an agent, some kind of an agent to infect the host. The host is us. Right? So the agent infects the host, and the host can have many different vulnerabilities. Are we healthy? Are we not healthy? What is our age? Does whatever the agent is affect like if you look at COVID affected the elderly more than it affected young, healthy people. What's your immune status? Do you have a healthy immune system? Or are you immunocompromised? Some people get the flu really bad. Others don't get it bad. Some people get COVID bad. Other people don't suffer from COVID as severe as others do. What's your physical fitness like? Do you get adequate rest? Do you eat good nutrition? Are you healthy? So depending upon the status of the host, that's going to have an effect on how the agent affects you. Like I said, flu, COVID, bacteria, viruses. Then the environment is the third part of the epidemiological triangle. The environment is simply that. What kind of environment are you in? We saw with the COVID, the elderly patients that were in facilities, their environment in facilities, close quarters, they were much more at risk to catch COVID and get sicker, right? So the environment plays a significant impact on how the agent and the host respond. And that's how infectious diseases are transmitted. You have to have an agent to infect a host. Depending on how healthy or not healthy the host is, and then in the environment. Where is it happening? Okay, we have a couple of kinds of immunity. We have passive immunity. Passive immunity is from somebody else, either from a mother or an IV administered antibiotic. So we get immunity from antibodies, vaccines. And then acquired immunity is you acquire an immunity to a disease from a previous infection, or a vaccine. That's your acquired immunity. So for people that had COVID vaccines, you hopefully have some kind of acquired immunity from that. An immunity from passive immunity will include, when they say you're resistant to antibiotics or you're resistant to a certain kind of antibiotic, that comes with, passive immunity. And then you have herd immunity, which is the immunity of a population of people protecting those that are not resistant to the disease. So remember during COVID, everybody kept talking about herd immunity. The more people can get vaccinated, the better in the population. That's called herd immunity. So agent, we talked about the disease cause, whatever the disease is. Okay, we have two kinds of transmission. We have vertical transmission and horizontal transmission. Vertical transmission of an infectious disease is the mother or father to the offspring. And then horizontal is person to person. Then we have a couple of time frames. We have an incubation period. We have a communicable period. We also have reportable diseases. Wherever we work, there's going to be a list of reportable diseases that have to be reported to your local health department. As a school nurse, we had a whole book of diseases that were reportable to our local health department. So I want you to be aware that there is a database of nationally reportable diseases. You don't need to know every one of these, but you just need to know that there is a database. There's certain reportable diseases that need to get reported. Then we talk about water. Water is treated through city, county, or municipal water treatment facilities. What happens if you have contaminated water or untreated water? That increases the risk of waterborne infectious illnesses. We commonly hear about cholera, giardia.
Is that like in Flint, Michigan? Or is that where there was it Flint, Michigan?
Yep, Flint. Yep. That was a terrible situation. Untreated water, right? Lots of people got sick. With regards to bioterrorism, and this should be up in the disaster section, but the two I would like for you to know about, and this is on your HESI study guide as well, is anthrax and smallpox. Okay, anthrax are typically cutaneous small sores that develop into the skin, create an ulcer with a black center. Okay, that GI symptoms, nausea, loss of appetite, bloody diarrhea, fever, and then respiratory effects. Deadliest kind of flu symptoms, chest pain, shortness of breath. So those are your three differentiating factors with anthrax: skin, GI, and respiratory. Then with smallpox, starts with flu-like symptoms and develops to a rash with red spots that become deep pustules, leave craters. And then the difference, know the difference between chickenpox and smallpox. Chickenpox also starts with a rash, but the dots, smaller red dots, they turn into small, clear blisters. What's the big difference about location of smallpox versus chickenpox?
Isn't chickenpox everywhere? You can get them everywhere on your body.
Except for smallpox, you're going to see on the soles of your feet. Yes. Smallpox you're going to see on the soles of your feet. You won't see that with chickenpox. Okay. So talking about foodborne illness and food safety, here's a couple of tips that we use when we're working with families and teaching families. Please wash your hands before, and I know we all know this, but we need to make sure we know it, because part of our role as a community nurse is going to be teaching families about foodborne illness, how to prevent that. Washing hands before and after handling food. Separate raw and cooked food, and also separate the equipment in your utensils. Thaw food in the refrigerator, not on the countertop at room temperature. Cook food thoroughly. Do not eat rare hamburger meat, and do not use food beyond its expiration date. We talked a little bit about waterborne illnesses. The pathogens usually enter water supplies through either animal or human fecal contamination, maybe chemicals in the water. And I think we talked about this during class. Do you remember the Aaron Brockovich movie, where there was water contamination from a treatment plant? Caused all sorts of cancers and problems in the community. We talked about cholera and giardia being seen as common indicators of waterborne illnesses. Vector-borne. What's Lyme disease? What causes Lyme disease?
Bye-bye ticks.
Ticks. And then Zika virus is caused by mosquitoes. Rocky Mountain spotted fever, dog ticks, and then malaria, which is caused by mosquitoes. So know your 4 vector-borne illnesses as well. Then we have HIV, which we know is a blood-borne infection that is spread in a few different ways: sexual contact, sharing of needles, maybe spread through breast milk. It used to spread through blood transfusions, but now the blood is always tested for HIV before transfusions. After some kind of a needle stick, you have a high risk exposure. Sexually transmitted disease are at high risk for HIV. Some of the common STDs that make you at high risk for HIV: chlamydia, syphilis, herpes, gonorrhea. And then what we also know about HIV is testing. Initially, you can get false negatives in the first couple of months, up to 3 months. So it should be repeated. Okay, repeated in 3 months, so that would be 6 months. Right, so know that the first can be false negatives, and then you want to be testing again at 3 months and 6 months. Okay, a couple of STDs to go through that you need to specifically know about are, first one is chlamydia, gonorrhea. That's bacterial. Okay, we have two kinds of STDs, bacterial and viral. Bacterial can be treated with antibiotics, viral cannot. Viral is this, there's no cure to viral STDs. It's basically a symptom management, right? So chlamydia, gonorrhea, it's a bacteria that's spread through sexual contact, treated with antibiotics. Specifically with chlamydia and gonorrhea, all sexual contact should stop until your treatment is completed. All of your sex partners for the last 60 days need to be contacted, tested, and treated. Sometimes it can be asymptomatic. Can also cause pelvic inflammatory disease, which potentially can lead to infertility, pelvic adhesions. So syphilis, bacterial as well, begins maybe as a painless sore or canker. And then it moves into your lymph system and causes flu-like symptoms. But if it's not treated with antibiotics in the primary and secondary stages, it can go latent and reactivate later, causing severe damage. Okay, once it's latent and reappears, it's no longer curable. It becomes viral. One of the biggest things with syphilis with regards to pregnancy, what's the big risk if it's not treated?
As in like deformities, like for the kid?
Yeah, if syphilis is untreated in a pregnancy, it could pose very, very poor outcomes for the baby. And that's why it has to be treated bacterially with antibiotics in the first, from primary and secondary. Then you have herpes, which I want you to know about. Herpes is viral and incurable. Hepatitis, we have 3 kinds of hepatitis. We have A, B, and C. A, and you guys, I'm sure, have learned about this in med-surg, correct? Yeah. Hepatitis A spread through fecal oral contact. B is bloodborne. High risk population for Hep B is IV drug users, STDs, multiple sex partners. Okay. And hepatitis C is also bloodborne. Again, the high-risk populations are IV drug users, infants of infected mothers. 85% develop chronic and lifelong, develop a chronic or lifelong infection, which can potentially long-term cause liver damage, liver failure, liver cancer. Another one is tuberculosis, spread through airborne droplets. The good news is 95% of the people infected become latent. Right? So everybody's had a TB test, right? For a job, for school. If it's positive, what do we do? What's the next step if your PPD is positive?
Get an
Chest
X-ray.
X-ray.
Chest X-ray. Okay. One of the other big misnomers in community health is when you have voluntary and mandatory home visits. Okay. What would be some reasons for a mandatory home visit? Maybe the court is ordering it for a specific reason. But believe it or not, a mandated visit is to check on positive TB patients to make sure they're taking their medication. Right? So if you go and try and schedule a home visit and the person who's infected says, no, I'm good, I'm taking my medication, don't worry about it. No need to come visit. No, you do need to go visit. That's a mandated visit. Okay? You're simply assuring compliance. Then with regards to infectious diseases, we talk about vaccines. Okay, working in the schools for 20 years, I had to work with a lot of families who didn't want their kids vaccinated, which is fine. That's their choice. They could complete a religious exemption, medical exemption, personal exemption, for whatever reason. But part of my job and part of our jobs is to still try and educate families that vaccines are the most effective method of preventing and controlling communicable diseases. Right? So just because they don't want their kid vaccinated doesn't mean we don't stop teaching. Okay. And then it goes through all of the childhood vaccinations, polio, diphtheria, pertussis, measles. They previously were epidemic, and now they're pretty much under control by routine childhood immunizations. They haven't been eradicated. So kids need to be immunized against these diseases. So the United States has a federal law that is really no shots, no school. Okay. And for those of you that have kids in schools, you all know what I'm talking about. Whether your kids are vaccinated or not vaccinated. If they're vaccinated, you provide the vaccination record. If they're not vaccinated, you provide your whatever exemption. Okay. What I want you to understand about vaccinations, though, is that there are some vulnerable populations that may be at risk for not getting vaccinated. Those vulnerable populations include infants and toddlers. They're a group that's most vulnerable to these severe diseases. So if they don't receive their scheduled immunization, they're going to be at risk. And then research shows that inner city kids, children from minority or ethnic groups, are particularly at risk for incomplete immunization. They don't have the resources. Maybe they don't have the transportation. Maybe they don't have the knowledge of the need for the kids to be vaccinated. And then there's all the religious exemptions. There may be certain religious communities whose beliefs don't promote the vaccination. The other group that's at risk is adolescents have a lower rate of coverage than children or adults because they don't as frequently access preventative care and follow up on their shots. So there are a couple of questions on the exam about vaccines. Okay, so please have a look at this paragraph right here. And then the rest of your notes, the rest of this next section just goes in more detail about STDs. Okay, we talked about bacterial versus viral. We talked about syphilis being potentially transmitted transplacentally and the dangers. Surveillance outbreaks. Okay, we need to know the difference. Surveillance. So these are diseases in the community. What's the difference between surveillance and outbreak? Okay, nurses are very involved in surveilling and outbreaks. As a school nurse, I was always doing surveillance in the schools for outbreaks of certain things: pertussis, chickenpox, strep, COVID. Okay, so think about the ADPI here. Observation and surveillance is the process of ongoing systemic collection, analysis, interpretation, and dissemination of health data used to monitor the disease trends, whatever it is, whatever that disease is. There's differences. The purpose of observation, it's right here. The purpose of observation is to assess the public health status, identify disease patterns, what resources do you have, and develop programs for rapid response. That's your ADPI. We are always asked to convert our ADPI in each different content area. So that's how the nursing process, that's how your ADPI looks with regards to observation. Assessing the public health status, identifying trends of these disease patterns, setting priorities, putting together a plan, and then developing your programs for rapid response and evaluation. Okay. Surveillance, on the other hand, is done to reduce morbidity and mortality. How's that done? It's done by trying to prevent or control the spread of disease, but does not focus on eliminating community-based infections. That's in your observation. So basically, surveillance is to reduce morbidity and mortality, trying to prevent the control of the spread. Okay, there's a couple of things we need to know. There's 4 surveillance systems. And I'm just going through this quickly because hopefully you reviewed your notes. Okay, there's a passive system. There's an active system. There's a sentinel system. And there's a syndromic system. Okay, so these are, how do we surveil? Passive, that's what I used to do as a school nurse. Passive is I'm passing along the information to the health department. I got a call from a parent that said their kid was diagnosed with pertussis or influenza. Okay, passive. So hospitals are contacting the health department. Urgent cares are contacting doctors' offices. We're providing the information to the health department. And then active, the public health department picks it up from there. Now they're searching for cases by actively contacting providers. So let's say we had a number of people go to the ER with food poisoning. And upon their investigation, they found out that the same group of people ate the same restaurant on the same dates. So it would be up to the health department in the active surveillance system to go and contact other hospitals. If you have any patients that come in with this and this, let us know. So they're trying to surveil how many more people are out there that might have been infected or might have had eaten that contaminated food. Okay, so you need to know what each of these systems are. And then with disease, transmission of disease, we have patterns of occurrence. How did it happen? How did it occur? So you have some different kinds of occurrences. You have a point source outbreak, which is basically, there's a point, it's very specific. We were all on the train together and we all were exposed to this chemical leak. We're all going to get sick at the same time. Okay. And then you have an intermittent outbreak, which is kind of like the example of food poisoning, right? Where we've been exposed to something over a period of time with people getting sick at different times, such as food poisoning. Okay, and then you have a mixed outbreak and you have a propagated outbreak. So you need to know the difference between the surveillance systems, the patterns of occurrence. You may be presented a scenario on the exam that says, which kind of pattern of occurrence is this? You know, everybody was in the same place at the same time and everybody got sick. What kind of pattern is this? Well, that's a point source outbreak, right? So know the difference between the 4 of them. And same with the surveillance systems. And then when we're doing the last part of this is when we're doing community-based programs, the very first thing we have to do, think ADPI here. is do a needs assessment. There's a couple of stages of that needs assessment. There's the pre-active stage, there's a reactive stage, there's an inactive stage, and there's an interactive stage. Okay, so if you're given a clinical scenario and the nurse is at this stage of the nursing assessment, or the nurse is doing a needs assessment, here's what she's actively doing. What are the stages? Or what stage is it in? So in pre-active, the nurse is projecting future needs. The reactive stage, you're trying to figure out what the problem is based on past identified needs. Okay. Public health nurses, first line of defense. We care for entire communities or populations. We mobilize, this is just some facts about public health nurses. Okay, we mobilize and protect the public during emergencies, such as the COVID-19 pandemic, right? We are always preparing for health emergencies, ongoing, always preparing. Okay. So that would be week 7, infection control, prevention, HIV, TB, STDs, and bioterrorism. So we covered those 3. Does anybody have any questions about last week's material? This week we talk about home care. How have we seen home care evolve over the years? Is more care being provided in the community, in the client's home, than it was 10 years ago? It's exploded, right?
Yes, because you used to couldn't get dialysis at home, and now patients can do dialysis at home.
Right. IV antibiotics at home. Right? Lots of things are being done at home. Where do patients prefer to be cared for?
At home.
In the comfort of their own home.
In the comfort of their home. Why?
That's where they're more comfortable at.
Comfortable surroundings, familiar surroundings. Family members can be around. So we used to do a lot of care that's done in the home now used to be done in the hospital. All right. A lot of what we're doing is tertiary care, right? People coming home from the hospital or coming home from rehab or coming home from long-term care facilities that we need to do the continuum of care for what they've been receiving. Okay, but also we do a lot of primary and secondary interventions with home care, right? We do safety assessments, environmental assessments, trying to teach people how to stay safe in their home, right? We want to try and give them training and education, nursing care through transition periods when they are at the beginning stages of an illness, end stage of an illness. Okay, so home care is really, really an important part of the nursing process now. Where I mean, people that leave the hospital and need care in the community. Who does that? Who provides that care? The community nurse. It's transferring the medical needs right into the community, right into the home. Case managers, nurses are often looked at as case managers, whether they have the official title or not. Lots of nurses do have the title of being a case manager. What is a case manager? What do they do? What does a case manager do? I'm sure all of you that work in organizations work with case managers. What do?
They oversee how everything goes.
They coordinate the care. Yep. Case managers are coordinators of care. So you may have discharge case managers that work with the patient, the family, the hospital, if the patient's going to a rehabilitation center, what services does the patient need? If the patient's going home, what services does the patient need at home? Do they need home oxygen, PT, OT? Okay, so case management is essentially the practice of coordination and management of patient care across the continuum. Whether that transition is from a rehabilitation center to home, maybe home to a assisted living, the hospital to a home. Case managers' responsibility is to coordinate all that care and all those services. Right? Case managers manage complex health needs. Right? It's going to include referrals, education, communication with multiple healthcare professionals, services needed. Do they need a home health aide? Do they need a home health nurse? Somebody to provide medications. They need help with their ADLs, cooking, whatever. That is the case manager's job, to coordinate services. Case manager also needs to be very aware of what community resources are available for their clients in the community. Right? Community resources enhance self-care. They help clients manage chronic diseases, and they try and help reduce vulnerability in these populations with the resources. I mean, we all know of volunteer organizations in our communities, whether it be food banks, clothing banks, Meals on Wheels, Red Cross, crisis pregnancy centers, domestic abuse shelters, churches, sitter services, transportation services, right? These are all community resources. Hopefully our community has. Some of the smaller rural communities may not have all of it, but we need to be aware of the community resources that are available to our clients. Okay. The rest of your week 8 notes are talking about these complex chronic illnesses. Cirrhosis, type 2 diabetes, pelvic artery disease, chronic venous insufficiency, hypertension. Okay, they're all set up nicely for you. Okay, where we'll talk about post-op in a minute, but for example, cirrhosis talks about what it is, goes through the nursing process with each one. Okay, so it talks about interventions. What it is, what are the interventions? COPD, what is it? What are the interventions? Okay, so it gives a very, very nice description of each of these. I'm going to have you guys read that on your own. I have condensed this section of the study guide into the more important, not that all interventions aren't important, but I've condensed it to be a little bit smaller of a version for each one. I know you've been presented all of these in MedSurg, right? You've talked about cirrhosis, right? You've talked about COPD. You've talked about type 2 diabetes, right? So hopefully this would be like a review. Okay. When we talk about post-op care, what do we have to think about?
The ABCs.
ABCs, right? You're asked to read pages 83 through 99 in your MedSurg book. Talks about post-op care, right? You have to be focused on our ABCs: safety, pain. And this is all in your reading. What are potential complications of post-op? What assessments need to be done? Okay, and we give you some examples here. Some issues with airway and breathing. You may get a little bit of atelectasis. Mild atelectasis is okay. That's expected post-op. Okay, Other complications, mainly pneumonia, PEs, embolies, clots, respiratory depression from pain medication. It's all part of your assessment. Circulation, DVTs, sepsis, dehydration, maybe a UTI from a catheter. Skin, your wound healing, and potential infections, pressure ulcers. Maybe some nausea due to medications or anesthesia, or constipation due to immobility. So these are all things we need to think about post-op, but please go back and read those pages, 83 through 99. This is just a simple summary of that. Okay, I will tell you that on the exam, there's questions, 1 or 2 questions of each of those complex chronic illnesses. That's why you'll see all of them on your study guide. Okay. So home care we talked about, community resources we talked about, case management, care of chronic complex illnesses. And there's all specific pages assigned to those. Okay. The other part that I want you to read is it's in your Canvas. There's one reading for week 8 that's in your Canvas module. It's addressing chronic disease. Please don't overlook that. That was part of your reading assignment. A lot of really good information in that reading page. Okay, so if you haven't read it yet, please make sure to review that. Okay. Questions. This is all out in the community. And I always say, just remember, people coming from places, hospitals, long-term care facilities, rehabilitation centers, they need care in the community, right? And that's what we do. That's what community nurses do. That's why this class is heavily focused on med-surg, a little bit of pediatrics, a little bit of geriatrics. Got to bring it all together. Right, so we're taking all this knowledge. You know, could you go into somebody's home and care for a client with cirrhosis? Would you know what to look for? Do you know what cirrhosis is? Do you know what to look for? Do you know what to assess? Do you know what to teach? Same with chronic venous insufficiency. Do you know what it is as a diagnosis? Do you know what causes it? What causes cirrhosis? How are you going to care for that? Remember, in the community, you're on your own. Lots of autonomy. Do you know what the diagnosis is? Do you know what to look for as far as complications or issues? What do you teach? Because remember, if you're caring for people that already have chronic complex diseases, you're in the tertiary intervention phase, right? They already have something. So what do you know about helping them manage their chronic disease, maybe improving their quality of life? Just because you have chronic venous insufficiency doesn't mean you're in the hospital. You're at home. Okay. So that's why it's important to have all your tools, all your information, all the classes you've previously taken. Now we're taking all that information and putting into clinical practice. Can you go into a home and take care of these kinds of patients? Okay. So let's see, it is just about 2 o'clock. So we're going to pull up exam quiz 5 and take quiz 5. Okay, we'll take it and then we're going to go through it. All right. And so we need to take it ahead of time. And because it's a quiz, it needs to be proctored. So I'm going to give you maybe 10 minutes, 12 minutes, 15 at the max, and then we'll go through it. But once you finish your quiz, you need to hit submit. Okay, I need everybody to submit it before we start going through it. All right, so everybody pull up quiz 5. Take your time. This isn't an easy quiz. Okay, think through clinical judgment when you're taking this quiz, and then we'll go through it. Okay, so I'm gonna mute myself for at least 10 minutes, and then we'll see how everybody's doing, and I'll keep an eye on who's submitting and who's not, but take your time. Okay? I'll be coming.
Oh, 7.
Looks like several of you are still working on it. Okay, maybe a couple more minutes. Okay, if you're all done, if you would just please hit submit. Looks like a lot of people are done, but I don't have a lot of submissions. So if you could hit submit, please.
I'm not done yet.
No, that's fine. I can tell some people are still reading. But a lot of people look like they're done. So if you could just hit submit. Hey, you ready to go over it? No, not yet. Okay. Okay, I'm gonna do 3 more minutes. It's 2:12. We're gonna start reviewing it at 2:15. Okay. Let's have a look at this. Okay. All right, so let's go through question 1. Okay, so the school nurse notes several children developing a pustular rash on their faces and extremities following several days of fever and malaise. Which is the next step for the nurse?
A,
What's the correct answer? Why is A correct?
because that shows that it is smallpox with the rash on their face and the pustules and the fever and malaise.
Yep. So that question has you needing to know how to recognize smallpox. Right?
Right.
Eventually we will assess their records, right? For their vaccination status. It may be recommended they follow up with a pediatrician. But first and foremost, we need to recognize that those are some of the signs and symptoms of smallpox. And as we talked about in class, smallpox and chickenpox are differentiated by location. One of the big differences is location. Soles of the feet, palms on the hands. Okay, that's smallpox. Okay, does anybody have any questions about that question? Okay, so the quiz is essentially a good indication of how well you're prepared for class before you come, how well you're paying attention during class. I mean, I can't go over every single thing, but I try and cover the important topics. So next one, nurse is caring for an immigrant who's pregnant with her first child. There's no vaccination records available. Which vaccine should be prioritized?
Rubella.
Why?
That's the first vaccination that they need to have.
Okay. What else? It's another big factor. What cannot, go ahead.
It's the flu too.
Pardon me?
It's the flu too.
Can you speak up just a little bit? What was the other answer? What can't pregnant women have with regards to vaccines? Did you guys have OB?
They can't get live vaccine.
Yep, that's why rubella is the correct answer. Okay. Does that make sense? Question 3. Health department nurse is caring for a 16-year-old female with a new diagnosis of gonorrhea. What education does the nurse need to provide?
B.
Why is B the correct answer?
Because that could be something else, but that's why I see why B could be the answer. But I chose A, continued antibiotics, because she was diagnosed, and you want them to finish their treatment for it. But I see why it's B as well, because it could be something else wrong.
Exactly.
A
Exactly.
says until symptoms are gone, but you want them to continue it even after the symptoms are gone. You want them to finish the full medication.
Right? You don't want to teach them just to continue antibiotics until the symptoms are gone. They may be gone 2 or 3 days into the 10-day course of antibiotics. Tiona, do you see that? They need to continue antibiotics until the course is done, whether they're symptomatic or not. Correct? Yes? Okay. Question number 4. The occupational health nurse is caring for a client who's just sustained a needle stick injury at work. What education should the nurse provide regarding HIV testing?
C.
Pardon me?
C.
Yep. And why C right?
Because when you get the test first done, then it can not be correct, and you have to come back in 3 months in order to do it again to get the correct results.
Yeah, we just talked about that in class today, that there may be false positives in the first couple of months, right? So you want them to return at 3 months and 6 months for return test for another test. Nurse is developing a primary prevention program for tuberculosis. Which intervention is appropriate? What's primary?
The prevention.
Prevention before it even happens. So what's the right answer?
C.
C.
Pardon me?
C.
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 Correct. And why C correct?
Because when they're in the houses, sometimes it's like up to about 50 people in one room, and that's the way that they can get tuberculosis.
Mhm. And so you're trying to prevent that from reducing overcrowding, right?
Right.
Okay. Question 6. The home health nurse is visiting a client recovering from a right hip replacement performed 8 days ago. The client is complaining of calf pain in the left leg. Which nursing intervention is a priority? What's the most
A.
important thing?
To assess it.
A.
Mhm.
A. Why is A the correct answer?
You
Because
want to
you
make
would
sure
want
that
to
they're not
assess it.
C.
What it potentially is edema in the left calf,
Mhm.
left leg,
Blood clot.
blood
Yeah.
clot. Okay. I mean, this is a good example of a question where you read all the answers and all the answers could be potentially correct, but the question is asking which intervention is priority. Well, when you read the question, it looks like possibly at risk for a blood clot, right?
Mhm.
Okay, number 7, the home health nurse is caring for a client with chronic peripheral arterial disease in both legs. What education should be included?
Okay.
A.
Why is A the right answer?
Because you need them to stop smoking, because smoking constricts their blood flow.
Okay, Why is B incorrect?
Because you don't want to constrict it by putting compressive stockings on it if they already, if you're assessing, I mean, I'm sorry, you don't want to put stockings on the area where they're having pain in their legs. You're restricting blood flow by putting tight stockings on it.
Mhm. How about C? Is that going to help?
No.
Okay, good job. Question 8, which dietary modification should be used with a client with COPD?
See,
And why is C the correct answer?
because then they can have enough like oxygen and stuff to be able to eat. And you would eat small meals, you wouldn't eat large meals. So that made A wrong right off the bat. And you don't
Okay.
remove the oxygen cannula while eating.
Okay. Yep. Does everybody understand why C is correct? Okay, number 9, the home health care nurse is caring for a client with cirrhosis who lives alone. Which intervention is a priority? So it gives you a couple of cues in the question.
A,
A.
Why is A the right answer?
because you have to worry about their safety.
Mhm.
Okay. Again, another good example of if all answers look like they could be correct. Got to go back to the question, did you miss a word? And here it's asking, what do we first have to assess? And that's this fall risk. All the others will eventually have to be addressed, but what's the priority? Right? So again, these questions are putting you out in the clinic, in the field, out in the home, or wherever you are, conducting your assessments, using your clinical judgment. Last question, which food should be avoided with a client that has poorly controlled hypertension?
D,
Soup.
Canned soup.
Mhm.
I heard D, right?
yes,
Yeah.
D,
Everybody
Yeah,
check D. Okay, why D?
Because
it's full
because
of
of the
it's
sodium.
high in
sodium.
sodium.
Mhm.
Because of the sodium. Sure. Yep. Hey, how'd you do?
I got 10 out of 10.
Oh, congratulations. How'd
I got
everybody else
10 out
do?
of 10. I got 10 out of 10.
Great. So your quizzes and your exams are clinical judgment. Taking all your knowledge and applying it to the patient's bedside, wherever that bedside is. Right? Does anybody have, pardon me, does anybody have any questions about what we covered today? Was this helpful information?
Yes.
It's just, once again, expanding your knowledge about what the scope of community nursing is. Right? A lot to think about. Remember, as a community nurse, you have much more independence and autonomy than if you were working in the hospital, right? Not a lot of people around to call or ask for second opinions. Rubella is not a live vaccine. Can't give pregnant women live vaccines. Cheyenne. Does that make sense?
Yeah. Okay. I thought it's contraindicated. So how am I mute?
I'm sorry, I can hear you.
Oh, okay. So I thought it was what vaccine like does she need?
right?
Yeah.
Rubella is not a live vaccine.
Oh, but I thought you couldn't give rubella when they're pregnant.
You can. It's not. The live vaccines are contraindicated.
Okay.
Anybody else have any questions? Okay, so I hope you guys have a good weekend. You'll be getting the study guide here in the next 24 hours, I promise. I've been promising it since, I think, Wednesday or Thursday. I just want to make sure it's accurate, and I'm just trying to find the time to finish it up. You'll have that in the next 24 hours. Try and get to a review session next week if you can. If you can't, then you'll have 3 recordings to watch. If anybody, you guys don't take the exam for 2 weeks from Friday, today. So if you get into the week of the exam and you're still having issues with some of the concepts in the study guide, please reach out and we'll schedule a Zoom meeting and we'll do some tutoring or review what areas that you're still not comfortable with. Okay. How's that sound?
Good.
All right. Well, I hope you guys all have a great weekend. You know where to find me. Reach out if you need anything. I've got, if anybody still wants to review their exams, let me know. I know I've got a few emails out there of students I just haven't responded to yet. I'll try and respond to you guys this afternoon. But if there's anybody else out there that wants to meet to review exams and you haven't yet, reach out to me and we'll try and schedule a time for next week. Okay.
I sent you an email. This is Chandra.
Yep, I saw your email. I just haven't had a chance to respond.
Okay.
Okay, everybody have a good day.
Thank
Good
you.
weekend.
Thank you.
Good to
a
see
good
everybody.
weekend.
Thanks for all your participation.
Thank you.
Bye.